Welcome back. In today's episode, I'm going to talk about one of the topics that is on everybody's mind, hair loss. So, today I'm going to walk you through the most common causes of hair loss that I see in my practice, why most people fail at the right treatments and usually feel they didn't see any results, and what are the latest and the most evidence based treatments that we have to treat hair loss with. So, let's dive in. So, let's start by actually examining the core belief which we need to have shifted. Hair loss, unlike most of us think, is not an age related concern because these days, believe it or not, my average age of the patient I treat for hair loss is 17 to 18 years, mostly in men. And even in women, it's getting younger and younger, and the average onset is actually in the early 30s. The common patient story that I see is that I've tried everything. I've tried the oils, I've tried the rosemary oil, I've tried the Nutrafol, PRP, or minoxidil for a month or two. No one sticks to any plan. And my favorite one, TikTok said rosemary oil would fix this, and that's what I've been doing. And lo and behold, nobody sees any results. If you don't understand the physiology and the biology behind why hair loss is happening, you're just throwing money down the drain, literally. So, here are the common causes of hair loss for both men and women. Number one is your genetic or hormonal hair loss, something we call as androgenic alopecia. This is the most common cause for both men and women. The bottom line is that the hair follicle is getting miniaturized due to a hormonal shift that we are now getting more of something called DHT or dihydrotestosterone sensitivity. What we notice is that you don't lose hair overnight, but the follicle is shrinking, the shedding phase is getting longer, and women notice these shifts commonly around postpartum. Yes, I'm sure you've seen that where I think the best time for hair, the most luscious all us women have seen is during pregnancy. And sometime right around that 5 month mark, we notice that hair shedding is almost to a distressing point where we don't even recognize ourselves. And then again, in perimenopause and menopause, we see massive amounts of hair shedding. And I can speak to every woman in her mid 40s and beyond, where we used to have a full head of hair and now it's just getting thinner and thinner. The bottom line is that estrogen protects the hair and testosterone and DHT is thinning it, especially as your estrogen level is declining. Once again, a hormonal shift. Along with that, the number three thing that I think we often miss or forget is nutritional deficiencies. So, when we are evaluating somebody in our clinics for hair loss, I would always want to get a lab panel. Not only do we want to check their hormone levels, but I want to test what their iron or ferritin levels are, vitamin D levels. Vitamin D is not only for our bones and our skin and mood, it's also very important for hair growth, as well as B12 levels and our zinc levels. And to make matters even more complex, even if you have normal labs, normal doesn't mean optimal. And sometimes, even if something looks normal by the lab range, for hair growth, it might be a suboptimal level which needs to be replenished. And lastly, my favorite one, stress. So, stress is probably the number one reason why after COVID, I would say hair loss has become a pandemic. Everybody's suffering from it. And that is not to say probably because of an ever increased levels of stress in our society. And anytime we have a stressful event in our life, something called sotilogen effluvium, which is because of stress induced hair loss, typically, the actual shedding is seen 3 to 4 months after that episode of stress that you will have. Common triggers for this are weight loss, surgery, breakups or divorce, and chronic cortisol surges. Your hair remembers stress way longer than you do. And lastly, the next cause is inflammation or overall your scalp health. So, poor blood flow, fibrosis, dandruff, inflammation, eczema, all of those reasons can lead to increased inflammation on the scalp. And you can't grow hair in infertile soil. So, you need to make sure that our scalp is healthy. And that is why, because we are just thinking once again that one magic lotion, potion, or shampoo or an in office treatment is going to treat all of it. And that is why we're always disappointed. And when we understand that hair loss is a complex problem, and we don't need, in fact, just a one or two pronged approach, but we actually need almost like a five pronged approach, we will definitely be able to make a dent in this problem. Most people fail hair loss not because they haven't tried one thing, it's because they've not tried everything, first of all, cohesively, and then they have not given it the due diligence. They've not tried things long enough, and then there's no maintenance plan because it is a slow, but if done right, can be a very rewarding process. We have to just keep in mind that this is not one of those cases where we can get instant gratification. So let's dive into my step by step treatment philosophy to give you that full head of hair, shall we? Step one, I would first recommend that we get a full medical workup, especially if you have not had regular physicals. And even if you had, the tests I would say that all of us should really have a good understanding for are number one, our hormone levels, especially estrogen and testosterone, as well as your DHT levels. Number two are your blood counts. Are you anemic or not? And even if you're not, what are the iron or your ferritin levels? Number three is going to be the thyroid hormone levels. Low thyroid levels and sometimes even high thyroid levels can lead to hair loss. Your inflammatory markers like your SED rate or my personal favorite, HSCRP or the C reactive protein, which gives a very good indicator of what the stress levels and the inflammation levels in the body are. Last but not the least, I always like to take a look at the medications that somebody's on because some medications lead to hair loss as well. Step number two would be what are the foundational medical treatments we can prescribe to a patient before we invest in all the ancillary in office treatments or topical solutions. So, minoxidil or Rogaine by the name brand is probably the most tried and true topical, or even sometimes oral medication that we use. So, minoxidil helps by increasing the blood flow and extends the growth or the anagen phase of the hair cycle. So, low dose oral minoxidil has actually been a total game changer for many patients because a lot of you don't tolerate the topical version very well. It can be greasy, it can be annoying, and some people truly have a sensitivity for topical minoxidil. So, in clinical studies, we have found that low dose minoxidil is actually just as effective, if not more effective, than topical. So, that would be the first line of approach. Second line of approach, mostly for men, and sometimes for my postmenopausal women also, would be topical finasteride or dutasteride. I personally prefer dutasteride because it is more local and systemic absorption is less. So, this is inherently a prostate medication which blocks the conversion of testosterone to DHT, which is the bad kind of testosterone which inhibits and miniaturizes the hair follicle so that you don't get hair growth. So, dutasteride or finasteride, when applied topically or sometimes in a low oral version, preserves the hair follicles and helps block the DHT levels. So, that'll be my second line of defense. And then, thirdly, let's talk about all the novel regenerative therapies like PRP or platelet rich plasma or PRF, which is platelet rich fibrin. And this is one area where there's been a tremendous amount of excitement as this is a novel treatment. Not so novel anymore because we have experience for at least the last 10 years. So platelet rich plasma works by releasing growth factors which stimulate the follicles and increase the blood supply and also enhance that microenvironment for the dormant hair follicles to wake up and create a new hair growth cycle. Sometimes we inject after topical numbing the PRP or PRF, and sometimes we follow it up with microneedling, which is collagen induction treatment to stimulate the hair follicle as well. And these treatments can be and should be done after we have done everything that we just spoke about before, because just throwing treatment money on these treatments in the office and not supplementing your nutrition, making sure that biologically all your hormone levels and vitamin levels are replete, then we are just, if we are going into the office thinking that this again magical treatment is going to be that unicorn which is going to solve all the problems, we will be disappointed. It's not a one step approach, but this is one of those instances where I always say throw the kitchen sink at it, because hair growth is a slow game. And lastly, in the office, a very promising new treatment is called by a company called Alma, and it's called the TED or TED device, which stands for Transepidermal Delivery System. So it's an ultrasound based device which infers with air pressure, increases the blood flow to your scalp, and then it has a proprietary mix of growth factors, vitamins, nutrients, which we infuse into the scalp using ultrasound or sound waves. And typically speaking, all these treatments are done once a month for 3 or 4 times. Once again, along with as an adjunct, using topical minoxidil as well as dutasteride if needed. Along with that, I always recommend taking oral supplements in the form of either hydrolyzed collagen peptides or Nutrafol, so that we've tackled topical, we've worked from the inside out, so that now when we fast forward 6 months, we've given the body everything it needs for optimal hair growth. So this is hair growth restoration in a nutshell. Soups to bowls and nuts, it's a lot, I understand it. But if we had a cohesive approach where we first see a doctor or a hair care expert and have a full plan, I'm sure that all of us can find some of these things that can work for most of you. So, once you have done your initial treatments and now we're getting somewhere and you have a head full of hair, how do you maintain it? Because once again, we don't want to be in that cycle where we're just trying to reinvent the wheel over and over. So, for maintenance, this is the time when your scalp health becomes very important. This is the time when some of the shampoos, including ketoconazole shampoo, which is meant for dandruff, in fact helps with hair growth. In addition to that, there are some infusion therapies that you could get done, like the hydrofacial scaraweave, which is pretty well tested and studied to help maintain a healthy environment for the hair follicle so that it stays healthy and gets all the right nutrients. This is also where probably anecdotal treatments like rosemary oil massage may not be a bad idea, not as your initial treatment, but to increase the blood flow of the scalp. And in all honesty, it may not, I don't know how much of it is the rosemary oil or really the massage, which is increasing the blood flow to the scalp, which is an amazing thing. So, long story short, I would say keep your scalp healthy and clean. Don't let it just sit and accumulate in excessive oils, and get some infusion treatment so that it just can continuously irrigates and keeps the scalp healthy. I hope that helps. If you have questions, please leave in the comments below, and until next time.